What's causing your or my Achilles tendon pain? My name is Dr. Chad Coons, and I'm a sports physical therapist, and today we're going to talk about what is actually causing your Achilles tendon pain. Why is it there? And we want to answer some of those questions. So first off, let's review the Achilles tendon. The Achilles tendon is the strongest tendon in the body. It's got connections from the calf. It's got connections from the soleus, which is kind of a calf muscle that sits deeper underneath, okay? So really, again, the triceps area is what sits right in here, or the Achilles tendon, and it does have fascial connections as we look underneath. You can really see it kind of runs all the way into the fascial connections, and eventually it turns into the plantar fasciitis, all right? So some take-home points is that it is the strongest tendon in the body. It does have fascial connections and in the plantar fascia. And it really does have a huge influence on the ankle, foot, and the knee. And we're asking ourselves, well, if the Achilles tendon is so strong, why is it painful? So before we can answer that, we need to answer a few questions. I did make a video on running form, the technicalities between a heel striker or a forefoot striker. And I think we really need to answer that question as to what your running form looks like, particularly how you're striking. And I'll just kind of give you the Cliff Note version, but I do want you to go watch that. It's amazing how the energetics are distributed so many different ways when you land heel versus forefoot. When you land heel, in my experience, long story short, the hip is being able to get involved at a much higher level, which can help attenuate force, so that the Achilles tendon doesn't have to do nearly as much hard work. A lot of times, not every time, but a lot of times, people are having pain in their Achilles tendon due to the running form, particularly because they've been taught to be a forefoot or midfoot striker, and you might be kind of irritated or frustrated or like, I don't agree with that. That's okay. All I can say is, in my experience, I work with a ton of runners, and very few, if any, have been successful in the long term. That's a really key word there. Have been able to sustain a pain-free running style and to be able to run the way they want to. So feel free to go ahead and check out that video. So the other thing that I'll say is that you have to have your running form assessed. There's a lot of different angles and modifications onto your running style. So whether you are a vertical striker, so you're up and down a lot, whether you've got weak hips, whether you've got really tight inner thighs, you've got a scissor gait, that really needs to be broken down from all three angles. So from looking from behind, looking on the sides, and then looking looking in front, we need to see where the knees are at, and it really is kind of almost a whole body sport. In fact, people have had back pain because their back was doing too much motion. Sometimes the arms aren't even involved enough. They don't give enough of what we call a reciprocal arm swing. So we need to make sure that your running form is being assessed by an expert, and that we're not just quickly glancing at it. Also, we need to evaluate your strength. We need to see what your overall strength looks like. So this is one really good video I wanted to show you guys. Let me go and pull it up here. So this is one way to strengthen your calf. I like this view the best. And I'll put a link to the video here below. It's actually a great way to assess your overall strength too. So one leg is going to be up against the wall, and you need to keep your legs straight. So I would be assessing my left Achilles tendon strength and calf strength here. Now the key thing is that your left leg has to be straight when you do so. Keep the left leg straight. Mine's got a little bit of a bend. That was a better lockout there. So this requires great synergy between your quads and your calves. And this is honestly one of the top best 7 running exercises that I like almost all my runners to do. And that's where you'll see this YouTube playlist. It's within that. But this is a great way to get the glutes, the quads, and the calves all firing. So we need to make sure that we've got great strength in the calf to help prevent future injuries. We also need to have really great mobility. Let's go ahead and take a sneak peek at a mobility drill. Again, I'll leave Um, I'll leave you guys the links to all these. So to get to the Achilles tendon, I like to get us in this half kneeling position, and I like to kind of rock the knee towards the ground, put a good eccentric load on it. Although this is the strongest tendon in the body, it needs to have good mobility. So I'm just kind of giving you some cliff note variations on how I like to get improved Achilles tendon length and mobility. And I'll leave a link to watch this video as well. But the point that I'd like to make right now is that we need to have not only strength but also good mobility. And those are a couple stretches and exercises that I found helpful. We also need to make sure that you have good ankle mobility. I can't tell you how many times people have told me that they've had a previous ankle sprain or injury to that ankle, or just something traumatic, a car accident, who knows, that's happened, and that ankle has always been their bad ankle on that side. In addition to that, making sure that you've got good, strong hip muscles is crucial. Again, so I've seen a lot of correlations. Let's say this runner has right Achilles tendon pain. If I go up to assess their glute max, their glute med, or any of these key muscles, as we call like the deep six, seriously guys, I bet 9 out of 10 times their hips are weak or weaker on that side compared to the opposite side. Can't tell you how incredibly crucial it is to make sure your hips are strong. Although the Achilles tendon is the strongest tendon in the body, it doesn't need to be doing all the work. It does not need to be doing all the work when you're running. We need to be able to find a way to distribute the load throughout the entire leg. Hip mobility is really important too. A lot of my runners are tight into external rotation. They might have tight hip flexors. They might have a weak core. A lot of times the hip is weak into external rotation. We need to make improvements in that. These are your external rotators that sit back here. It's crucial that we get a good strong hip with great mobility as well. In addition, questions that need to be answered about why you have Achilles tendon pain is, when did it start? If this is acute, this might be potentially a form of tendonitis, which is going to be treated completely different versus chronic. Chronic would be more of a tendinosis. A tendinosis just means that there's kind of been scarring down, there's edema, there's some swelling. We're going to need to treat that with progressive eccentric training where we strengthen the calf and give it good hard elongation and mobility work. Whereas acute, it's a tendonitis, right? We need to calm it down, irritate it, because the tissue will be much more irritable in your Achilles tendon pain. So we need to know when it first started. 2 weeks versus 2 years, we will need to treat you completely differently. Has it happened before? Is this repetitive in nature? Is it always that side? Could it be both sides? What's your training status, right? Did you just start? Are you doing marathon training? Did you ramp up your mileage? Did you go from 40 miles a week to 80 in 2 weeks? How much did you progress that? So those are questions that we need to answer. In addition, monitoring your shoe wear. Generally, we should be changing your shoes every 3 to 5 months, really depending on the mileage. Some people even less. It always cracks me up when we're talking to someone and they haven't had their shoes changed in 2 years. Not that that's most likely the sole reason to the problem, but there's a good chance that if we improve their shoe wear, things will improve right there alone. I can't put enough emphasis on the fact that you need to be doing strength training programs, not just for your Achilles tendon, keeping that strong, but to your entire body. Running is a sagittal sport. It's only forwards, all right? That's pretty much all we do. So we need to challenge other planes, as we call it, the coronal planes or transverse planes. So we need to be definitely implementing some form of strength training program for you. I'd say right now, to help out with your pain, you could try heat. Find the shoe wear that's right for your foot. That also goes for orthotics. Make sure you've calculated the mileage that you're doing and you've got a rationale for why you're doing that mileage, depending on when your race is coming. A lot of our runners will just sign up and pay for a race and then want to get right into it. That's not what we suggest, of course. So a strength training program at some point in the year is crucial, if not doing it all the time, but a low level, even a day or two a week, working on those weak spots. We really strongly believe in doing a form of myofascial massage to your Achilles tendon pain too. Whether it's acute or chronic, we found that that's almost always helpful. And then lastly, improving the mobility in that calf as well. So make sure that we address your running form and that you have significant improvements in your ergonomics. I can't speak how important that is as well. We see people who've failed physical therapy several times or chiropractic services all the time, and we ask them, have you ever had your running form assessed? And they go, actually no, I've never had that. They might have the running coach do it for them, but with our expertise as sports therapists and with our background, we feel like we can really tackle the root cause. So I hope that explains a little bit about why do you have Achilles tendon pain and why does it hurt. If you need a running evaluation, that kind of melds right into our Pr1me assessment, where we could basically get you out here and take a look at your running form and discover where your weak links are, assess really the entire kinetic chain. We can learn a lot from that. So thank you guys so much for tuning in to today, and we hope to see you soon. Take care.